Discord is up. Good morning, America. How are you today on this 12th day of December? And I guess, guys, it's the first day of Christmas, according to the song, no? And but it's also the first day of the lockdowns here in Pennsylvania, where the governor mandated that we had to close. We indeed had a wolf come in wolf's clothing. Welcome to our show. It's called Pushback. It's called Pushback because that's how it was born. It's pushback against all these draconian authoritarians that are trying to take our liberty. So we're trying to teach you how to stand on your own 2 feet and defend yourselves. And may you be happy today. May you be safe. May you be healthy. And may you be living with ease as we today look into an uncertain future. So, but I'm hoping that you are ready to affirmatively contribute to the challenges that our country is going to have, in the next couple of years. The show is brought to you by Pennsylvania Patriot Raddio, and of course by Normal America with Robert Knorr. My co-hosts are the aforementioned Robert Knorr and Todd Bartlett. Good morning, guys.
Morning.
Excuse me. Good morning.
So I want to give a hat tip to Smashlin 69420 on TikTok for my opening. As I try to describe to you how we lose our liberty by degrees. It's just a mask. It's just 2 weeks. It's just so we don't overwhelm the hospitals. It's just non-essential businesses. It's just until the cases go down more. It's just a vaccine. It's just a few side effects. It's just a bracelet. It's just so others know you're safe to be around. It's just an app. It's just so others know that you've been in contact, who you've been in contact with. It's just a few more months. It's just a video. It's just an email account. It's just a credit card company. You can use cash, but it's just a few places that won't take cash. It's just a little chip. It's just some medical information and medical things. It's just for travel. It's just so you can get your driver's license. It's just so you can vote. It's just a few more years. It's just a statue. It's just a building. It's just a piece of paper. It's just a flag. It's just a piece of cloth. Come on. It's just a blood test. It's just a scan. It's just a dog. It's just a clump of cells. It's just the bad people. It's just the undesirables. It's just the Jews. It's just the Christians. It's just the people that don't think like us. It's just that we're going to make them pay. That's what they're saying. That's how they're stealing our liberty. We're sick and tired of getting zero value for our money and our vote. Imagine if they put that type of, that same type of energy that they're putting into COVID, and they put it into obesity or heart disease or cancer or smoking than they did for this COVID. Or, poverty. Imagine if they put that type of energy in there. So I don't know where we're going. But I know that I'm grateful. Last night I had dinner with my wife, and it was the anniversary of the 40th anniversary. Can you imagine? Of our first date, December 13th, 1980. It's 6 days after John Lennon was assassinated, and he died on a Monday, and our first date was on a Saturday. And I'm grateful for that, because my life is more than just politics. I have great kids. I have the best wife. Pack your crap up and go home, guys. I'm sorry, I apologize, but I win. I have the best friends, best colleagues. It should be illegal how happy I am. But that's important right now, is for you to be happy, and for you to take care of your family, and for you to take care of your friends, and for you to take care of business, and for you to stand on your own 2 feet, and don't put up with any crap from anybody at any time, and protect yourselves at all costs, especially after the bell. With that being said, good morning, the great Robert Knorr.
Good morning. I'm glad. 40 years. That's amazing. I'm sure my wife thinks that the chance that we'll make it 40 years is declining every day that I'm in this lockdown with her. I think she's had enough of me. So, but
come on, it'll be fine.
But no, I agree.
I'll give you some tips off air.
Yeah. No, I agree with what you're saying about the incremental taking of our rights. Even with the election, this is something that we see. The election, it wasn't that it was stolen election day. It was stolen because we allowed laws and policies to be changed, and we allowed collusion of the cultural narrative to be controlled by the establishment for decades. We allowed this. We allowed China to interfere in our country and get its tentacles in our country. We allowed these tech companies to be so biased and partisan and to obtain all of this power. We allowed Tom Wolfe to initially have these draconian orders. And this is what we see. It's the incremental. They're not going to just wake up one day and say, we're taking all your rights away. It's a long, drawn-out path that we've seen.
Degrees.
You're right. And that's why it's important to fight these things at every step.
The great Todd Bartlett. How you doing?
Good morning, Carlos. Congratulations to you and Melinda. The good news about last night, as opposed to 40 years ago, Carlos actually drove, Melinda rode shotgun, as opposed to 40 years ago when he made her get out and push.
That's right. How did you know? You have video, right?
That's right. There's a video. But no, congratulations on the longevity.
You got an opening statement this morning? December 12th?
And to your point, what we didn't know back in the spring is what we know now, is that yours truly and Wendy Bell Radio are going to be working together, right? And earlier this week, I'll use this phrase, ground was broken, if you will, on the National Pushback Studio.
Awesome.
From your mouth to God's ears, buddy.
Right? So Wendy's new national broadcast studio is being constructed as we speak.
Fantastic.
If you follow me on social media, you saw a picture of a ladder and a couple of sawhorses.
Yeah.
I'm not showing you what's behind the curtain yet, but it will be fantastic.
Well, fantastic. Good for you. And that's, of course, the new operation that you're going to be a part of. And although we don't have a lot of details yet as to exactly what the nomenclature of your position is, you and Wendy and your team is going to be doing some great things in 2021, and we really appreciate you. And
she sends all the best to the show.
We do appreciate her. She is a friend of the show and a fellow patriot, and a person that's concerned.
Yeah, when she was on radio on the other place, she had a guest several times, and if I'm not mistaken, she's even had that guest who we're about to talk to here in mere moments on the social media show too.
Well, let me tell you about our next guest. I've been living in Williamsport since 2003, and I've been involved in politics for most of that entire time. For those that don't know, and I don't talk a lot about it on the show, but I'm in media, a filmmaker by trade, but I'm in media, and I specialize in media for politics. So as a media analyst and a media strategist for politics, you get to meet all the people, all the players on the battlefield. And one of the nicest people in Lycoming County has to be Charles Kiesling. Charles asked me to help him with his social media, and I got to tell you, there's things that when you are involved in projects, especially in social media, sometimes things go a little slower than most. It was meteoric, the rise of how popular Charles was and how his channel mirrored that popularity, and that was punctuated by the video that I produced for Chuck that came back. I guess it was April or I think it was April, right, Todd? And we called out the governor on his COVID numbers, and Chuck was right and the governor was wrong. And I'm sorry, that's just the straight talk. That's the straight talk of it. It's no jazz. That's just what happened.
And nothing changed since then either, with the numbers still being off.
Yeah. Well, so he's the county coroner. It's an elected position. And because it's an elected position, I invited him on today to spend the majority of the show, not so much to get his political opinion, because I'm not interested in his political opinion. I'm interested on what he has to say with respect to the facts on the ground and making clear to people exactly what's going on so they're not confused. So we have lots of questions. I know Rob has lots of questions. We talked about this, but he is the definitive expert as to what's happening on the battlefield here in Lycoming County with respect to COVID. And, one of the things that I said in the opening is, we're at the point now where there's so much stuff coming at us that we don't know. We don't know what's true or not anymore. Off air, we were talking about, the servers in Germany. Rob and I would love to comment on the servers in Germany, but we don't know anything about that. And here's the worst part, guys. We don't trust anybody telling us anything about the servers in Germany. That's pretty bad, right? We don't trust anybody. We don't trust what they have to say. We don't trust their sources. We don't know until we know. So that being said, I would like to introduce Charles Kiesling, the Lycoming County coroner, and also the president of the Pennsylvania State Coroners Association. Good morning, Charles Kiesling. I think Charles is on mute.
Yes,
Hello?
he needs to unmute himself.
Yes.
Unmute. There we go.
There you are.
Good morning.
How you doing? Did you?
Okay, how are you?
I know that you just unmuted yourself, but I hope that you heard my entire opening introducing you.
I did. I'm very humbled by your comments, and thank you for inviting me to kind of be on the show here and provide you with some what I see, at least from the coroner standpoint. It's been a busy, couple of weeks here. Especially the last week, the number of COVID deaths has certainly spiked, and we're seeing significant numbers here in Lycoming County, and obviously across the state. But the one thing that stands out, we've had 93 COVID deaths here this year. That's all total. That's all folks that the average age is about 84 years of age of all of those 93 individuals.
In Lycoming County?
Yes, in Lycoming County.
What's up, Todd?
Yeah.
Chuck, first of all, welcome to the show. I don't know if you want to go video or not. It's up to you. If you want to stay audio, that's fine too.
Yeah, we can.
I mean, your video, you can. It's okay either way.
Yeah, no problem. So we're at 90. We're at 90. How many?
93 right now, as of today.
Okay. And the average age is 84 years old.
Average age is 84. Yeah, video's not coming up yet for some
That's
reason.
okay. Now, I do have a question about the number, and we've talked about this for months and months and months. How many of those folks were in long-term care facilities? Oh, in addition to that, multiple comorbidities. And as the president of the Coroners Association, if you would, and again, we're not holding you to this, this is an opinion. If you were to put a number, a hard number on those numbers, could you say definitively how many of those folks actually contracted COVID and passed away from COVID only, if there's even a number?
I don't know that it's extremely difficult, because all I can tell you, the 93 cases that have crossed my desk and that I've had conversations with doctors and nurses and that were involved with caring for these folks at the time of their death, they all had many comorbidities. They've got COPD, diabetes, cancer, Alzheimer's, dementia, coronary artery disease, hypertension, renal disease, congestive heart failure. I mean, they have a lot of comorbidities that make them much more vulnerable to any kind of infection. So, and it's very difficult from these cases without autopsies to be able to say absolutely they have a COVID test, but did they really die from COVID, or was it just kind of the triggering mechanism that kind of tipped them over the edge? And it's very difficult without autopsies. And we're not typically autopsying these folks because we don't want to put other people at risk in further delineating and narrowing down the cause of death on these people. So a lot of them are dying with the COVID-19 test, but they also have a whole laundry list of other medical issues that led to their demise.
And that really hasn't changed since the outbreak of the pandemic, has it? I mean, you're not seeing a difference in the way the virus acts in the body since the outbreak began.
No, I mean, it seems to be the same. I mean, and like I said, we've got a lot of elderly folks here. I think there certainly have been some younger folks, but I have not seen a single person die from just COVID-19 and the effects of COVID-19. All of them have other contributing conditions. And again, the average age is, the youngest was just this week, 53. But again, additional, a lot of comorbidities that came into play.
So real quick before we go to Robert and then back to Todd, I want to make sure none of the COVID deaths in Lycoming County have been autopsied. Is that correct?
Correct.
All right, so we can't confirm that they really died from COVID or from, let's say, God forbid, if you had asthma. which is
Correct.
probably
Yeah.
one of the worst comorbidities that you could have if you're a full-blown asthmatic and you get COVID. If you die, did you die from COVID or did you die from asthma? That's a fair question. You really can't tell unless
Right.
you have an autopsy. Is that correct?
Correct.
Okay.
Correct.
All right. So let's go to Robert Knorr. Robert.
Yeah, so thank you so much for being here today. We really appreciate it. Has there been a spike in these deaths recently? Is that something that you've seen kind of exponentially increase in the past month or so?
Yeah, I mean, there's been a significant increase in the number of cases, and also, and consequently, I'll just go back since December 1st. The numbers here in Lycoming County, the positive cases were at 2,243. As of yesterday, we were at 3,532. So that's about what, a 1,300 increase just in the next 12 days. So, and just the last week, there's been anywhere from 90 to 200 increase per day. So we're seeing, the increased positives, but some of that, I think there's being a lot more testings being done. So you're going to see the more, positive cases come through, but you're also seeing an increase in the negative tests. There were 166 negative tests as of 12/11. That was just the daily testing, and 248 positives, an increase yesterday. So,
and is there a critical shortage of ICU beds in Lycoming County right now?
I don't believe I'm hearing so much of the ICU beds, but I have heard that ambulances are being held on the ramp for in excess of an hour until, if they have somebody that's a PUI or a COVID positive person, until they can get them into the emergency room. So there is a lag there in trying to get them into the hospital because of they want to protect the other patients that are in the emergency department. And so that certainly has caused, some difficulty with, excuse the can opener in the background.
Well, if you've ever been to a hospital, Chuck, you know that the waiting time in an emergency room could be hours. So yeah. That was a little gallows humor there. But to be very honest with you, here's the question that I want to be able to make seed in people's mind. What's the difference between regular people being concerned, and Chuck Kiesling being concerned? So of the things that are concerning to you, what are the most concerning things, which then would in turn make us be concerned? We would still do all the right things: social distance, wash our hands, clip our nails, take our temperature, wear a mask, all those things. We're not stupid. Everyone knows what they have to do. But when does Chuck Kiesling get concerned?
Well, I get concerned.
What on the dashboard will concern you, which then will in turn concern us?
Well, I'm concerned about this, this increase in numbers. That's bothersome. The sudden increase in numbers of deaths, that bothers me. But I also am looking at all of these factors, and how many of these people were going to die with or without COVID. That's really difficult to determine without autopsies on these folks. Some of these people are dying, and they have a positive COVID test, but they have no symptoms. They're not short of breath. Didn't have a fever, didn't have a cough. They just, went into a cardiac arrest and died. Well, if you're 98 years old, you've got a lot of medical issues. That happens.
Right.
Sadly, but that just happens. So, and I they had 98 good years.
Right. Right. And not to be macabre, but the difference is that COVID might not be a killer. Okay. I'm not saying it is or it isn't. It might not be a killer, but it's certainly a helper, right?
Yeah. Yeah.
Okay. So you say that you're concerned about the number of tests and the number of cases and of course the number of deaths. So the thing that Robert and Todd and I wonder about is, if we know that the average age of death is 84 in Lycoming County, why can't we protect these people?
That would be my thought process, would be to let's protect these people that are, in excess of 70 years of age, that have other comorbidities that put them at risk. They have, diabetes, they have cancer, they have COPD, they've got, anything that, hits their immune system, or they compromise their immune system, and makes them more vulnerable. It seems like that would be a good way to try and, protect those folks. They seem to be the most vulnerable. Now, at least from what I'm seeing here in Lycoming County. And I believe there are other counties that are seeing deaths of younger folks. People are being hospitalized, younger individuals. But again, I think they have, comorbidities. I don't think the average healthy individual is just suddenly coming in contact with COVID and dying. At least that's not what I'm seeing.
Well, and that, to me, that's the crux of this entire thing, is that I thought from the get-go that, and this is not from a medically minded standpoint, but just from a freedom-loving and, someone who recognized the importance of the economy. To me, it seemed like the proper reaction to an illness that we know little about is to protect in every way possible the most vulnerable populations, but to maximize freedom in the rest of the population. And so, do you see that there were things that could have been done more from our state government to protect the elderly and other people with comorbidities, and perhaps some of those resources were deflected in towards ensuring lockdowns were in compliance with people in the general healthier population?
I wondered early on whether we shouldn't have, we shut down a perfectly functioning hospital in Sunbury in January of this year, and whether that hospital shouldn't have been opened up, reopened and made it a specific COVID type unit. And, rather than bringing these people into all the hospitals or even nursing homes, bring them into a facility like that and make it one COVID, facility for managing these people. Now, obviously, if they need to go to the critical care beds like ICU at Kiesling or UPMC Susquehanna, then they'd have to do that. But to try and keep the COVID positive, the sick COVID people more isolated from the negative individuals. But now it seems like, we're just playing catch up. There's so much with, 3,532 positives just in Lycoming County, 470,000 positives across the state. It's going to be difficult to try and corral up the positives now. Maybe early on, if we could have done something like that, it may have slowed the spread.
Yeah, and that's an excellent point. Like, so me and my wife she got diagnosed, and I know I have COVID last Saturday. Here in Clarion County. In Clarion County, in the town of Clarion, there were no options for rapid testing. And to even get a COVID test, we had to have a referral from a doctor. She found out Friday night that someone in her family tested positive, so she didn't have an option to even get a referral until the following Monday, and she's 9 months pregnant. So we had to go to a town about an hour away in order to get a rapid test. And it just seems like the reason I bring this up, it seems as if there are real practical things that we could be doing as a government to not only increase education of how to keep yourself safe from COVID, when you should get tested, ease of availability of tests, but it seems like instead of that, there are these arbitrary policies that I think are disastrous, that are just far-reaching, that say, oh, well, we're going to say no indoor dining. And I just think that to me, I was just wondering, do you think that there was a better potential from politicians of all sides, Republicans and Democrats, to be able to work with medical professionals like yourself to get information and access to testing and things like that to people in the state of Pennsylvania?
I certainly would think now that we've been going through this for all these months that the testing is obviously more readily available in the communities, but I've had coroners call me up. They were still having trouble getting deceased persons tested. Well, and I understand they want to keep testing for the living folks, but this person was alive before they died, as we all are. And they have contacts with their family, with their coworkers, with other people, the EMS people that may have been involved in resuscitation. And, that kind of testing needs to be done in a timely fashion. And in one case in particular, it took about 5 days to get the person swabbed and then another 2 days to get the test results back. In the meantime, that individual had contact with a lot of people and unfortunately probably spread COVID to other individuals before his death. And he was 41 years old and didn't have a lot of comorbidity issues. That wasn't here in Lycoming County, but that was another county across the state. So those are things that have been frustrating from the coroner's standpoint is, hey, we know this individual needs to be tested, but we still don't have the resources. The hospitals don't all have the capabilities of doing the testing. And we still seem to be jumping through hoops with the Bureau of Laboratories at the Department of Health to get testing done. So they tell me they're working on fixing that, and hopefully that will be the case as time goes on here.
Yeah, they've been saying that since March. Chuck, I got a question for you. It's twofold. One, how are you seeing COVID spread? Is it any different than at the outset? And then I'll have a follow-up for you too. But just on community spread, that's referenced all the time. How are you seeing it? How's it being researched that it is spreading?
I'm not sure that we know exactly how it's spreading. I mean, from what it's obviously going through these nursing homes now, whether it's physical contact with something, or whether this is being transmitted. You're too close to someone in the patient care room and, someone coughs, sneezes, and passes this. I don't know that we know for sure. I know there's a lot of work going into the ambulances and helicopters, and when someone's transferred that's COVID positive, there's a huge process for completely decontaminating all of those vehicles and the rooms when these persons are in, so that if there are, if the COVID gets transferred to an inanimate object, then someone, comes in contact with it, that, they're trying to reduce that. So there's a lot of work being done, but we're still seeing the increased numbers. I mean, it's not stopping. Yeah.
So I have so many questions, but
I don't know if I have all the answers.
How does if we have 90+% compliance of wearing masks, how does one person, or how does anyone that didn't vote for Donald Trump, that wears a mask and does all the compliance, get COVID, like, the governor?
Yeah. I don't know. I mean, apparently, he came in contact with it somewhere, and that's the problem. I mean,
can you get COVID via aerosol contact in your eyes?
They're telling us we can, because when we're doing, as you know, my other job is I do work as a flight nurse. So We're wearing eye protection. We're wearing N95 masks. We're wearing gloves, gowns. So to do everything we can to protect ourselves when we're transporting these COVID positive patients. So, so we've got to, the experts are telling us it can be transmitted that way. So I'm going to take all the precautions that we need to protect ourselves.
Is this true? Is this a true statement, what I'm about to say? That you could have 100% compliance, you could wear masks, you could social distance, you can wash your hands, you can clip your nails, you can take your temperature, you could social distance, you could do everything that every single person and every single expert said. And this disease is so insidious and can transmit really in so many different ways that there is no foolproof 100% guarantee that if you do the things that the governor tells you to do, that you won't get COVID. Is that not correct?
Correct. Yeah, I don't think there's any way to absolutely, unless you're going to go lock yourself in a bubble, we're all susceptible to it.
Right.
I don't.
In your medical opinion, do you think that at least did we know that in March? They might not have admitted it, but we knew that in March, right? I mean, we kind of did.
Yeah.
Right.
Yeah.
So that being said, what are the things can you explain, before I go down my line of questioning here, can you explain to people, because Chuck, I know that you and me might know, but a lot of people don't. Can you explain as simply as possible what herd immunity means?
Well, I think it's a matter of getting the infection,
Right.
And developing your own antibodies to fight that infection.
Mm-hmm.
And hopefully the folks that have, the 3,532 people that are now positive in Lycoming County will, develop that herd immunity, and hopefully all of us will eventually develop that immunity or be vaccinated, to try and protect, folks. But it's going to be a long process, and unfortunately, those that are elderly and have other medical issues may not survive to develop that herd immunity.
Right. But so the tactic has to be that we have herd immunity in conjunction with creating a firewall with anyone that's 60 or over. Doesn't that make sense?
Seems to make sense to me, but I'm not a medical expert. I mean, there's people with a lot more degrees and medical background than I have to.
Let me ask this, because it's something a lot of people are asking. There have been reports that this year's flu season is dramatically declined in the amount of cases and the amount of people passing away from the flu we've seen. Is that something you're seeing in Lycoming County? Have we seen far less flu cases?
Yeah, Carlos and I talked about that the other day. The problem is I don't have a real good, I see flus or deaths or cases are not reported to my office as those people are still alive. I went through some of my records yesterday and I found very few cases that were attributed to the flu as people that have died. So I'm only dealing with those individuals that have passed. So I don't have a good answer for that. But I would venture to say that probably, the regular flu cases are probably down and COVID tends to be up.
Todd?
Chuck, I hate to ask you this question, but I'm going to anyway. I'm the son and grandson of, he's since passed, but my dad's still a funeral director, as we've discussed many times. I mean, as a coroner, you and I think, and me being the son of a funeral director, I think we can all agree that, there is a certainty in life that everyone is going to die, right? We can agree on that?
Oh, absolutely.
Okay, so the talking point that's been put out by certain people in elective office has been, well, if you don't comply, you're going to kill somebody, right? If you don't mask up, if you don't do what we're telling you to do, you have the potential of killing somebody. Do you feel like that's pretty over the top and really disingenuous when these same folks put COVID positive people back into long-term care facilities?
Yeah, I mean, if the problem is we don't know who's positive, but most of the people that I've talked to that were positive had some sort of symptoms. If you're completely, this goes back to the old adage: if you're sick, stay home.
Right.
And if you're not sick, then okay, wear a mask, and stay social distance, safe distance to protect other ones in case you happen to be one of the positive persons that is completely asymptomatic. I mean, I had one of my staff ended up positive. We don't know how, and was out for almost 3 weeks until the symptoms subsided. And he followed the CDC recommendations and got released by his doctor to come back to work. So yeah, I mean, I think that we've got to be careful, but I don't see how shutting the restaurants and completely capsizing our economy is really going to fix this. I guess we'll see in 3 weeks if the numbers really subside, but I'm not really thinking that's going to happen.
And that's my follow-up. And I think Carlos is going the same way too. That's my follow-up. You as a coroner have seen and certified the other side of this, the emotional toll, the mental health toll, the drug overdoses. Can you expound upon that and what you've seen firsthand, the collateral damage that's been done because of the economic shutdowns?
Yeah, we've just this year we've had 14 suicides so far. We've had 35 drug overdoses so far this year, and let's see, we were at 39.
49, right? 14 and 35, 49, right?
Yeah. And last year we had a record year of drug overdoses was 39. So we're a little bit under that, but that was a horrible year. These, free time on people's hands, unfortunately, drug dealers didn't seem to, slow the trafficking down to our communities. That continued through the whole course of this year. It's not slowed down at all. So,
Well, let me ask this: as a medical professional, how difficult? And you understand the need for things like people to take seriously COVID and social distance and things like that. How difficult is it when you talk to people to convince them that they need to take these steps when other medical professionals and leaders like Tom Wolf have violated their own orders whenever they found it convenient? So in other words, is it difficult to convince people, yes, you need to make these sacrifices, when our very leaders say, I choose to violate my order when I feel it necessary?
That's very frustrating. I don't operate as do as I say, not as I do. I've been in the office for 20 years and I don't expect my staff to do anything that I haven't already done or would do. And I, as much as I hate masks, but I wear them. I wear them, because I want to, try to protect myself, protect other people, and be respectful of those folks that are maybe more vulnerable because of their medical conditions. And so I'm going to do what I can to protect our residents. I've always been one to try and reduce the number of deaths and injuries in our community for the last 20 years. And I'm not going to stop, doing the same thing I've been doing.
So I guess the question that I have for you is, let's back up just a little bit. Can
Okay.
you give us 30 seconds to a minute on your experience starting in the medical field, and how you got to coroner, and then talk about your affiliations in the state and how long you've been a coroner, and then roll into explaining to us, just the people, okay, just the people of Lycoming County, your constituencies, why in Pennsylvania your voice is not important to other higher level politicians that are not medical professionals.
Okay. Well, my background is I started out, actually worked in the emergency room I was an EMT and I worked in the ER for 26 years as a registered nurse. I've worked pre-hospital as a paramedic, as an EMT. And then in 1997, I had been working as a deputy coroner. And at that time, I was appointed to fill in the remainder of the term for my predecessor. And so in 2000, 1999 ran and elected in as coroner. And I've been reelected every 4 years since then, serving Lycoming County as a coroner here. And so, and through my whole career as coroner and even as a nurse, I've looked at, I started the child death review team back in 2001, and I've looked at every death that comes across my desk, and I'm involved in the investigations, and I try to gather enough information to say, are these deaths preventable? And if they are, how can we, reduce these deaths, educate in the community, increasing the seatbelt use, so we reduce the number of teen driving deaths that we saw early on in my career. And we've really pushed that hard. And I think in our numbers of teen driving and deaths from people being ejected out of vehicles in Lycoming County has certainly decreased. And so I've just continued, we started the infant Cribs for Kids program in 2008 because we were seeing infants dying while co-sleeping with adults. We were then able to see a significant decrease in the number of those deaths. And we've just continued that whole, my office as I've kind of put in play, is we're protecting the living through the investigation of death. And that's been my model and goal for, the whole time I've been in office. And so I'm, again, trying to do the same thing with this COVID, death situation, is to try and look at the real numbers, try to pull out what's real and try to continue to protect folks in our community. So I think we do have to be cautious. It is deadly for individuals that have significant risk factors, and we just we got to protect one another. And early on, I had, as the president of the State Coroners Association, I had met with, by conference call with the Department of Health, and I, 1218 number 7 in our statute says any deaths due to contagious diseases that constitute public hazard are to be referred to the coroner's office. At that time, their legal counsel said, no, these are natural deaths. They don't need to be reported to the coroners. And so we discussed this, for a period of time. Our state solicitor also discussed this, and we tried to say, look, we really need to be we should be working as the right hand of the Department of Health.
Right.
And unfortunately, that never happened. I finally said, I'm going to have to agree to disagree. And we left it at that. I said, and so the numbers of positive cases, rolled out, and we started to see some positives here in Lycoming County. And then there's been a disparity because they're reporting deaths based on the residence that the deceased lived in, not necessarily where they died. My office, I'm reporting deaths based on they died here in Lycoming County. It doesn't matter if they lived in Clinton County or Tioga County, where their address was. So there's always going to be that discrepancy in numbers. But I think the state right now is showing us somewhere around 60 some deaths. And I know we just had another one reported this morning. So we're at 93 COVID deaths in Lycoming County. So there's a significant disparity, and it takes time. The other problem is with the Department of Health system, they're using the electronic death registry system to track and report these deaths. Well, the doctors that I've seen, death certificates come across my desk, they're handwritten yet. They're not using the electronic death registry system. So it takes time for that death certificate to get entered into the electronic death registry system, and then for them to look at those deaths and pull that information out and put it into their numbers. So whereas the coroners, we get the deaths reported within hours of that person passing. The nursing homes, the hospitals, the paramedics, they all call us right at the time of death. We're getting that information, and so we have more accurate information. We're also getting the accurate information that doesn't show up on a death certificate, because we're questioning the families about their symptoms. We're talking to the nurses, the doctors, and gathering their past medical history and seeing if they had significant medical issues. Did they have symptoms of COVID? Were they short of breath, cough, fever, all of those things? So we're gathering all that information, not just a snapshot from an electronic death registry system.
So,
and for those following along at home, by the way, when you look at it online, it's EDRS is what Chuck's talking about. It's the EDRS system, which Department of Health, by the way, has also changed about a half a dozen times since March.
Yeah, that's the electronic death registry system. It's the statewide system that they've been trying to get up and running, but it's just been 4 years or better, I think, in the making, and it's still got a lot of bugs to work out of it.
So here's the question that I have. The Department of Health has experts guiding them. If it's not the coroners, who do you imagine could be an authority that is higher than the state coroners? And why would you not use the coroners as local partners and de facto health department people in the 67 counties? It's a big state, right? Not every state, not every county has a health department. So why not use the coroners as a de facto health department and have them be partners with the state? When they talk about experts, I mean, it feels like this. It feels like this. And, I'm nobody. I'm just a taxpayer. But they're going on the internet and they're looking for links that they like, and then they're posting them as reasons to lock our state down, like just happened 2 days ago, right? In that email or that press release that the governor had. Well, according to Robert Knorr's Harvard article, this is why we think it's nonsense. Not that the disease is not contagious and deadly and despicable, but the handling of it, the collateral effects and outcomes, that's not science. That's politics.
I only got my video to come up here. I don't know what happened, but the computer decided to turn on. But
fantastic. It needed to be warmed up, like a pitcher.
I guess. I don't know. I mean, you know, the I just think that there could have been I'm not saying that coroners we're experts at death investigation. That's what we do every day. Now, not every coroner is a nurse or a paramedic or a doctor and has medical degrees, but we do spend every day of our lives investigating deaths and gathering information about those deaths. So that was my point 9 months ago, that I was saying we really should be the right hand for the Department of Health to gather information. So we have accurate information about why these people are dying and whether they're dying because of, with a COVID test that's positive, or they're dying with COVID, the disease causing their death, whether they have all of the symptoms, the shortness of breath, the cough, the fever, everything that goes along with that before they die. And so that's where I think the coroners could have helped gather that information better than what the Department of Health can. But
well, so let me give you a cynical fastball here for my co-hosts. We don't need the coroners. We don't need Chuck Kiesling. We're telling you that these people died of COVID. We don't need a death expert to tell us how they died. We're telling you that they died of COVID. Is that not correct, Robert?
Right. Yeah.
I mean, and I know that Todd has been witnessing this since March, but that's the reason why the coroners are not involved. One last question before I bring in the great Tony Massar. So tell me, what is losing your sense of taste and smell unique only to COVID?
it seems to be, from the people I've talked to that have tested positive for COVID, that seems to be the big trigger that says, yeah, that when the taste and smell, that's kind of the factor that triggers this from, okay, I've got the flu, I've got the fever, the cough, maybe a little short of breath, but now all of a sudden the taste and smell go away, and now they seem to be getting tested and found out that they're positive. So
you can't really tell definitively, and we can't really tell why, because we're not permitting anybody to do autopsies on people who died of COVID to see exactly what the taste and smell thing is all about. Is that just naive, or is that just me talking junk science?
Well, the reason for not doing the autopsies is mainly to protect the pathology people that are doing these autopsies.
Granted, but the outcome of having an autopsy is a better understanding of what not having any taste or smell means.
Well, it would help if we did autopsies on a lot of these cases. And the other thing is, out of, what did I say, 470,000 people that are positive, and we've had statewide, what is it? What are we up to statewide deaths right now? I'm not seeing that on my paperwork, but you also, if you look at this, okay, there's all 470 some thousand positives, but there's also a lot of people that have recovered, because these numbers are going from all the way back when we started testing. So why are we not showing the number of people that survived? Now dropping the numbers.
There's the classic Chuck Kiesling right there, throwing a fastball that no one realized was a strike. What happened to all the other people?
Yeah,
right. And I was just talking to I was talking to someone in the county, in a high position, and we were laughing about the fact that there's a lot of people who've taken the test and a lot of people who have tested positive, and there's a lot of people that recovered, and then there's a lot of people who died. But the biggest number is the people that are missing from the people who tested positive, and the people who recovered, and the people who died. There's like tens of thousands, and sometimes in the country, hundreds of thousands of people that just completely, totally disappeared.
Mm-hmm.
Yeah. So anyway, I'd like you to stay on because there's going to be more questions, and I'm going to bring in Tony Massar right now.
Okay.
And so I met Tony Massar, had to be in 2008, and we were working for a political campaign. And I've been living here for about 5 years. And when I first met him, I said to myself, this is the prototypical guy, you know, a guy's guy that that I knew back in Jersey, you know, and I think that we hit it off instantly. Okay. You probably, I don't know, didn't like me and still might not, but you know, his gift is that I think he does. But a personal friend, and one of the very few people I trust in politics, a friend of the show, a fabulous supporter of small business, community, nonprofits, political candidates. The list is so long that we don't have the time to go into, but is now a three-time sitting Lycoming County commissioner, and owner of numerous small businesses. And I'd like to introduce to you my friend, Tony Massar. Good morning, Tony. You're on mute.
Good morning, Carlos. Thanks for that introduction. I'd also like to thank Chuck Kiesling for spending the time to educate us here today. I was on for a little while. That gentleman works tirelessly. We talk about Energizer bunnies or Donald Trump. He ranks right up there, if not surpasses President Trump when it comes to work. He is a phenomenal person, and I appreciate his dedication to the people of Lycoming County. Yeah, we did meet around that time. I'm always drawn to people that excite me, have a passion. You can have a great intellectual conversation with them. And that's why we hit it off right away, Carlos. I could feel and sense and your passion for what you believe in.
So passion is a great word to describe what's happened in this country in the last 4 years. You could say whatever you want about the president. It's unquestionable that if his face was added to Mount Rushmore, it would be because he got people of every single stripe to get more involved in politics. Isn't that correct?
Oh, absolutely.
Like no one else ever. I mean, they talk about Bernie, but he laughs at Bernie. You know, Bernie couldn't bring him out on both parties.
That's not funny. That's not funny, Carlos. It's not funny.
You came for the intellect and you got the humor. So give us, and let's just start at the beginning. So it was Wednesday morning, right? Or 4:00 on Wednesday. We got the news from the presser that the governor was shutting down the state. Give us a quick overview of what's happened in your life since 4:00 on Wednesday to today.
Well, obviously, we reached out to the business community, and especially my son is in that category of closures again. He had contracted COVID, and his bar was shut down. His bar restaurant was shut down for already 4 weeks. Businesses and people need to take personal responsibility for what they do and how they're going to respond. And he did, as well as I did. Mary and I had COVID, and we shut down Rainbow for over 2 weeks. All right. We shut it down for a number of reasons: to protect our employees, who are still good, with the exception of one, and to protect the public. I think that's just common sense. I don't
Right.
need the governor to tell me to do that. It's
Right.
common sense. And that's what most of the people here in Lycoming County have. It's common sense. We're not going to try to get somebody infected or, pass the COVID on. But with the asymptomatic people, sometimes it's very difficult to recognize it, and you won't. And I think that's one of the issues.
Todd.
Well, first of all, thank you, Commissioner, for taking the time. Same thing to Chuck as well. I've been doing some research, and my understanding is the familiarity that Governor Wolf has with small business is a story that somebody told me, is the fact that he actually started in a big business and they waited. That's how it became a small business. They waited. So
It's funny.
the reason I bring this up is the familiarity he has with the economy is from a former large business that's now a small business, right?
Mhm.
And it's why you end up picking winners and losers, which they did that in the waiver process. They're doing it again with certain categories. How do you respond to the fact that the governor and Secretary of Health have again done this to large and small business? Because, any number of franchises, large business, right, have small businesses and communities with their local franchisees that are now, or local franchise locations that are now affected by another shutdown.
To me, Todd, defiance. But I am not one of the restaurant or licensed alcohol licensed businesses that may have spent anywhere from $100,000 to $150,000 for that piece of paper. Okay, I sympathize with them because although they would have, for the most part, 100% the support of the community, that means nothing if the state has the power to take that license from them. So they're stuck between a rock and a hard place. I've said on many occasions, I would defy, regardless of what I had. This is your livelihood. This is your life. And it's not just yours. Last night, I supported my son's restaurant bar for the last time because they had to shut down at 11:30. They shut down at 11:30, had everybody out. And look at the confusion and the concern on his employees. Go ahead.
I have a question for you as a follow-up. I really do. Taste of Sicily was fined. They were threatened, everything else. They have a litigation and a finding and an order from a judge that said, and they defied the governor before. They got all their fines back. They didn't lose their liquor license. They didn't lose it. They're going to stay open again in defiance of the governor. And what we're finding is there are very friendly courts that are saying it's the livelihood over the governor, right? That you have to be able to definitively prove that COVID is present in that business for an extended period of time. And what the law says is that it's 72 hours within the pandemic act that they cite all the time. You have to be able to do that for 72 hours. That's the limit. It's 3 days. So why are not more bars and restaurants and other businesses staying open?
Fear. That's my only, explanation. When you have the PLCB come in, they're intimidating. I'm not justifying, but that's their job. I think it's wrong. And I don't believe that there is science showing that high spread rate in those industries.
Right.
I don't believe there's science there. And if there is, I would almost guarantee you that the stores that they are keeping open will spread it more than them. And I don't see any science there either.
And to your point, Dr. Levine was asked by a fellow media member, apparently one that has a spine like mine. It they're very rare, Commissioner, since March. Apparently, I'm handing out spines since March to fellow media members. They asked Secretary Levine yesterday, well, what science did you use to do the shutdown? Oh, well, we've cited studies from 6 months ago. No. In Pennsylvania, what scientific study are you citing? Oh, we don't have that kind of data point.
Right.
They haven't had it since March.
We don't have that granularity. That was the direct quote.
Well, and
So they're still making it up 6, 8, 9 months later. So why not defy the governor, Secretary of Health, and stay open?
right, and here's the thing. Like, it's criminal. They haven't commissioned a study or science to get this. They're just making it up. In New York, which is passing a similar measure, Cuomo and Wolf, good buddies apparently, they're locking down indoor dining as well. The study there showed 1.4% of transmissions came from the restaurant industry. 1.4%. You are collapsing an entire sector of the economy for 1.4% of transmissions? So it doesn't make sense, the science we do have. And again, thank you so much for being here, Commissioner. Here's something I would like you to expound upon. You talked about how you and other people in your family willingly, when you knew you had COVID, not only I have COVID right now, actually. I'm the same way. I quarantine because it's the right thing to do, but you actually shut down your business. I think that what we need to do to get more businesses to realize that it is not only their right to stay open, but it's actually the patriotic thing to do, is to let people know we are not suggesting that we're unwilling to make sacrifices. So if you could just talk for a minute again on how you willingly were able to shut down your business for a while to ensure that the public didn't get COVID transmitted to that, and how one of the things that's so outrageous about this is we're listening to people like Governor Wolf, who called us cowards for wanting to have our businesses open, but then immediately violated the order when it was convenient for him to go march with groups like Black Lives Matter that he supported. So can you just let business owners and the Pennsylvania people know this isn't us being stubborn saying, oh, we just want to do things the way we want. We're literally saying we're willing to make sacrifices as long as they're rooted in science and as long as they're not being applied in a hypocritical fashion.
Okay, when we talk science, we have to talk data that we have here locally. That's how I'll base my decisions. And I'll leave it up to the experts. And one of the experts that I always call upon, Steve Johnson, from the UPMC, when he told me the other day, and this was before I closed down, this was, after I had closed down. This was just maybe 3 days ago at the tops, that at the testing facilities right now, 51% of the people are testing positive. Now, you could say, oh my God, that's alarming. Or you could say, oh my gosh, man, the more people who get it, the less we're going to have to worry about later. Okay? Because these people are, most of them are asymptomatic, and most of them are not going to have a cold or a flu type symptom. And there's probably less than 2% that are going to get it really bad and have adverse effects on them. So I had a little bit more knowledge as to what was going on in the community. And you just use common sense. Businesses should not be shut down, just should not be shut down at all. When we went to Don Patron's last night, I talked to I could tell she was a Mexican person, a Mexican descent. She had a little accent. And I said, well, are you shutting down today? And she said, yes. And I said, well, what are you going to do? And she looked at me with this glare in her eye saying, I don't know. I'm a single mother and I have one child. And I don't know. I don't have money banked like so many people don't, because they've been using their reserves to get through these last 9 months. That's something where we have to look at and try to help these people. And we can, locally, we can certainly do that with the COVID funds that we've received from the governor, and I think they still have another $1 billion. Okay, so I would say to the businesses, all businesses, stay open. Okay, but be smart. And it's easy for me to say because, like I said, I don't have that $150,000 license that they dangle over, in fear.
So, Commissioner, you know what Robert and Todd and I are all about.
Yes.
So, this is not a gotcha thing. Okay.
Right.
When I called you yesterday to have a very serious conversation about my concerns, and I like to joke that, like, look at my face. Do I look concerned? But I am concerned. I feel like we've been tapped on the shoulder and told to go out on the ice and make a play. Okay, that's hockey talk. I was raised in a hockey locker room. We need a play. I've been talking to every single political person that I know, every single political media person that I know on social media, on YouTube, on Twitter, on Facebook, on Snapchat, everywhere, to see if I could cull ideas on what would be the opening chess move to make Lycoming County the red line in the sand to fight this lockdown. And the reason why is because they did it in June, and then he road tested it again on Thanksgiving Eve, and now here we are. I did not get a single idea from all those people, from the vast wealth of contacts that I have across the world in politics. I did not get one single idea. And then God showed up last night, and the Lancaster County Sheriff put out a statement that said that they're not going to enforce the lockdown from the governor in Lancaster County. I say that God came down and touched us because that's the opening chess move. That's the opening chess move that I talked to you about yesterday that I was looking for, because if one sheriff will do it, then that will make another sheriff do it, and that will and it'll be a cascading effect of dominoes that goes across the state and hopefully across the country. What can we do? Robert and Todd and I, and I would like to include you in that. What can we do to give political, financial, emotional, psychological, physical air cover to these businesses to sit there and say, I'm staying open? What can I get from people, or from you, or from Sheriff Lusk, or from anybody in a position of authority to fight back, to go to someone like a Vince DeSalvo and say, Vince, on Wednesday of this coming week, we would like you to be one of 100 bars and restaurants to open in defiance of this. And here's what we got. What can I do? What can we do to fight back?
Carlos, I think you're doing it right now. Your messages over the last year have been very consistent. Okay, what is difficult is to have that type of unity, and remember, there are many people that look at COVID as a serious virus, and they don't want to be open anyway.
Right.
So you have to understand that.
Right. We're not forcing anyone.
But what I would say is this: the time for talking is over. We've talked for 9 months. We've seen the unintended consequences. We've seen the devastation that it has on businesses that didn't have enough working capital to make it. Okay. And it's time for the people to rise up, defy if you can and will, and then have the support, and I mean total support, of individuals that are like-minded. That's what needs to happen. And in my opinion, let them take the damn license. We're coming in and having, gonna drink at your place anyway, even if we have to bring our own booze and you use.
It's listen, we're there.
Yeah, I know.
Okay, we're here for the chicken parm and bring out the, the wine. Yes, Todd.
By the way, for them to take the license, as you've mentioned, that's a civil matter, if I'm not mistaken.
That's
right?
a process.
That's a process
correct?
in civil court. That it's not a criminal, act that you're defying the governor.
Right.
Like we're seeing it in Staten Island, where the bar owner keeps getting arrested, and he is the national treasure. That guy.
Right, and that's a question. That was my next follow-up question. Okay, but I didn't want to put the cart before the horse. So just hold on, Todd. May we have your permission to say that, as far as you're concerned, you support businesses staying open in Lycoming County, and we are the red line in the sand to this, and I don't want to put words in your mouth, and I don't want to pin you back, but I need your voice to be crystal clear to restaurant owners, because here's what I'm hearing. There are people that are doing this, Commissioner, and they're kind of looking around for support, that unity, because that's the only thing I offer. The only thing I offer as a media specialist is that whatever it is that we do, okay, and my job in politics as a media person is to take your ideas as the politician and execute them. That's my job. So the only thing that I have to say in being able to execute any of your ideas, whatever they may be, is if we do anything, we have to do it together in unity. There's 67 counties in Pennsylvania. We have to be a tightly wrapped thong of 67 arrows. You'll never break 67 arrows with your hands, right? So that's what I bring to the game. Can you be as clear as possible as to what your official position as Lycoming County Commissioner is with respect to supporting businesses staying open in your county? The county you were born in.
Absolutely. I support every business staying open during this time. There's no question. Now, who am I?
They need to hear that. They need to hear that, Commissioner.
I'm a county commissioner.
Right.
But more importantly, I tell it the way it is.
Yeah.
And if you're going to lose your business, what's the difference? What's the difference?
Right.
The governor, again, didn't give them any warning. People went out in the restaurant business and purchased thousands and tens of thousands of dollars worth of food. And guess what? It's 3 weeks. What are they supposed to do with that?
It's preparing for the Christmas rush. As a restaurant. I mean, and your son, do you think that your son didn't pre-order, in a way to try to get like the best sales? These wholesalers have sales for bars, and I'll take an extra keg. Why not? That might not be exactly what he did, but he did something in that direction. And now you're closing everybody down in the 3 most important weeks in the accounting calendar. Okay, they call it Black Friday because it's the very first day of the year that most people go from being in the red to being in black. Okay, and the rest of the month to the end of the year is basically their profit for the year. That being said, you're a small business owner. You're a county commissioner. Can you share with us, and this is what we don't see in the media because the media is in collusion, like Rob said, with these people.
With few exceptions. Thanks for not lumping me in. Go ahead.
You're a Buckeye fan, so that's it all.
They're not playing today. Leave me alone.
Here's the question. Can you share just one story of a small business owner that called you in June or July besides themselves because they were losing a lifetime of treasure and effort and work and business? And tell us a little bit about how those conversations went that you had to field from people that were losing and or lost everything. What does it feel like to have to take a call like that? And what did you say?
That's a very difficult question because I'm answering it from the information they gave me. Okay, I could never put my feet into their shoes. Kind of like if you lost a child,
Right.
How can you say you know what you feel if you've never lost a child? You can't. And these people worked their whole lives, saved, maybe invested everything that they had for their business, and now it's under attack, unjustifiably. Now I'm not minimizing the virus, okay, or the pandemic, but what I am saying is that you hear over and over and over again, do this, and this, and that should protect you for the most part. Okay. Well, when they start to shut down businesses, and I can give you a number of examples, these industries, small business or larger ones, they cannot take another hit. On the first hit, they're using their working capital in some reserves. Some are better off and some aren't. But they're using their working capital just to try to get by. And if you saw some of the loans that people took out, and I'm not talking small loans. I mean, because we had that application process, okay, to help them out with grants. When you saw some of the loans that they took out, it was mind-boggling. It was for them to survive, and they have to pay those loans back. They're not going to pay those loans back. They're going to shut the doors, because how do you pay loans when the government constantly does things to interrupt your business at a moment's notice? You can't prepare. How do you prepare for something like that? So yeah, I feel for them. It's terrible, and I pray for them. I do want to take it 5 steps up. What was it? The day before Thanksgiving.
Correct.
Eve,
Yep.
we had a business in South Williamsport that defied the governor's orders.
Yep.
And who showed up?
The state police did.
Right. So each and every one of us elected officials, each and every one of law enforcement swears an oath to the Constitution of the United States, however convoluted it may be now. We swear an oath to the Constitution of the United States. We don't swear an oath to the governor. We don't swear an oath to the president, your senators, or your elected officials. You swear an oath to the Constitution of the United States. And that can be interpreted by many different ways, okay? When does the state police turn into the Gestapo? That's the question. They feel like they have to follow the governor's orders. They work for the governor. Right? But wait a second. Put these people to death. There's no difference. There is no difference. And I was very disappointed in the state police when they did that. There's times to make decisions, difficult ones. We've put ourselves in a place where we need to make decisions. Some of us do, and not regret it. We're strong enough to say, I believe in my principle. I believe in the Constitution the way I interpret it. Listen to me. You get 5-4 decisions from the Supreme Court Justice of the United States, right?
Mm-hmm.
So they have a hard time interpreting the Constitution, unless, of course, they're following ideologies. But we better start paying attention to the law enforcement and how they're going to deal with this. Locally, I know my sheriff. I know my DA. I know my district magistrates, okay? I have full confidence that they will uphold that and not turn a blind eye to it. Absolutely not. They believe that there is an injustice being done. And so locally, I think we're in great shape with the people that we have.
So to add to that, doesn't the state police union endorse politicians?
I can't answer that question.
And if they do, that's a political act. And if they can do that, then yes, I understand that the state police works for the governor. Then the union can come out and say and give air cover to these police officers and says, yeah, we're not going to do that. If you believe that you work for the Constitution, not the governor.
Right.
And
right.
That's your point.
That's my point. You swore an oath to the Constitution, not to a tyrant. You swore an oath. If you're not going to uphold that oath, if you're going to let people hang out to die or drown, shame on you. Resign. Go find another job. Don't become part of the Gestapo.
Right.
Okay?
And that's what we've been saying. I said that earlier today, is that, yes, listen, none of us are crazy. Okay, maybe I'm a little crazy, but none of us are crazy. Okay, we're going to believe the experts. We believe the experts. Okay, but the collateral outcomes from believing the experts and acting on that, that's not science. That's politics. And that's where I think that the governor has overstepped its bounds. And to be very honest with you, and I've discussed this with Robert before. Listen, I think I understand what the governor wants to do. But you started from the wrong place. You started by signaling to us that you said that you knew what was best for us, when in reality, you didn't know anything. You were just as confused and just as ignorant as the rest of us were. You did not really know what to do. That's why you fell forward into this decision of doing the lockdowns, okay? And using the 2 weeks to slow the spread, and using the excuse of the hospitals that were never, was the hospital ship in New York Harbor? How many people did they get? 212 people that walked across the plank, not that were sick. So, the hospitals were never in dire straits. It was always used as a political football. Okay, that's what they mean. And that's what we mean by all of this being fake, is the politics around the COVID, not the COVID itself.
Carlos, can I
Sure.
Here? And I'm going to need our coroner's opinion as well. I'll play devil's advocate. One of the most important roles that a public official has is public safety. And so when we stay in communication with the healthcare providers and the system, the ones that are on the front lines, and they're saying that these tests are showing a 51% positive reading. So what, and I'll go back to the contact tracing that was done with us by the hospitals when we contracted, okay? Let's just assume that my son passed it on to my wife, or his daughters passed it on to him. He passed it on to my wife. She passed it on to me. Within a matter of 5 days, there were 5, 6, 7, 8 people affected. Okay, and that's 1-to-1.
Mm.
Okay, within 5-day period. And Chuck, maybe you know this, that's being having symptoms. Imagine what an asymptomatic person will pass. Okay, he doesn't, or she doesn't know they have it. Okay, so with that kind of rapid growth, you could see, and the numbers are undeniable when you look at them. Hospitalizations, these are the things that the leaders of Lycoming County needed to look at. When the hospitalizations run up, we're at 86, maybe even more now. When the ventilators go up, we're at 8. When I think, well, this is going back to 2000, this is going back to the 11th of the month. Ventilators, ICUs, we called, are you at critical mass? No, we're not, but we are getting concerned, okay? And now what we're seeing now is we're gonna have an extreme jump in positive cases here by the middle of next week, okay? Which is gonna put more pressure on the hospitals, which is I'm concerned about, because if you have a heart attack and there's no room for you, oh, that's not good, okay? So the hospital is it's the largest part of the equation for me making decisions. Okay, there's no question about that to me. What do we do? If more people have it, then naturally you're going to lose workers. Businesses are going to close down because of the positivity rate anyway. Okay, it just depends. So looking at it from that point of view, they're not easy decisions to make, but let those decisions be made by the people that are also on the front line as far as losing their house, their business, their livelihood. That should not be a politician that's doing that, as far as I'm concerned. Chuck, if you have something to add to that.
I mean, I agree. I mean, that's what we're looking at. We're looking at the number of people that are dying. We're looking at the number of people that are hospitalized. There's 10 up in ICU. There were 6 ventilated patients out there. So obviously, they're doing okay. And Geisinger is a little bit busier with their numbers from what I've seen, but but the number of deaths are continuing to increase. But again, as I said earlier, a lot of these people are the elderly that have a lot of comorbidities that are more at risk of becoming critically ill and or dying. It's not generally and I'm speaking to the choir because you've already been through it. So, you're going to be sick for a few days and, have the flu type symptoms. And, if you have no other comorbidity issues, your likelihood of surviving is significantly high. But we're watching the numbers, that's, it's going to continue. I mean, we've been getting hit here with, we had 10 calls just in 24 hours here with COVID deaths out of the nursing homes and the hospital here just in the last day or two.
So here's the obvious question. Okay. We all know what we need to do. This is just a quick roundup. The masks, the social distancing, the cutting of your nails, the washing of the hands, the taking of the temperature before you leave the house. What am I missing? staying with your family.
Surfaces.
Say it again. Not touching surfaces. Right. So, that
And
being
singing
said,
happy birthday when you wash your hands.
that being said, right, the length of how long it takes you to sing happy birthday, right? So that being said, Chuck, if by and large everyone is doing that, by and large, okay, I know that we're all tired and sometimes we forget, but by and large, these numbers supersede the things we're doing. You understand what I mean by that? The numbers are going up and we're doing this. What are we missing?
I don't know, but I can tell you, there are hundreds and thousands of people that are working in hospitals, in ICUs, and, that are taking care of COVID positive patients every day, day in and day out for,
Right.
10, 12, 16 hours a day. And some of those people are, getting the virus and getting sick, but a lot of them are not. And
So the majority of people that work with COVID people every single day aren't getting it.
doesn't seem to be, from what I'm seeing.
Have there been any deaths of any medical personnel in Lycoming County from COVID?
No.
Okay.
No.
You know what? Even the experts, I have to say, even the experts like Fauci and Governor Wolf must understand that mankind cannot be in charge of everything, right? Especially science. And I think that this is a great example of the fact that we just can't control everything.
Right.
And I know that the commissioner agrees with me totally, and so does Robert on this specifically hardcore. It's not the government's job to cure the cold. It's not the government's job to cure the flu or COVID. I know it sounds insensitive. It's our job. How the hell do you think I got here at 61 years old by myself to have this conversation with people? How do you think I got here? Because the governor walked me through this path? No. I got here on my own wits. I mean, these restaurant people have used every single piece of wit that they had to try to stay alive. They put plexiglass between tables. They took out tables. They put masks on. They had systems to let people in and out and different doors. They did everything possible. This is an insidious disease. It's highly contagious. The coroner just said that we could probably get COVID from the aerosol of it being in the air, that from someone who has it through their eyes. I mean, the government wasn't designed to do this. So why are we subservient to that type of authoritarianism or having the boot? Why do we allow to have that boot put on our necks? And I guess I before I get the question is really more for Tony, but I'd like to have Robert come in and chime in and Robert knows what I'm trying to say, but I think he could probably say more eloquently. I'm a little hot right now.
Well, no, here's the point. You're absolutely right. The thing that made this country the greatest country in the history of the world is that we understood the importance of the individual and individual responsibility and freedom.
Right.
That's what allowed our country to become so great so fast. And everything we see as a result of this virus is and the lockdown measures as a result are antithetical to that. So, for example, before we knew whether or not lockdowns would be effective, they were mandated by governors like ours and people all over the country. We still don't have any evidence that these lockdowns are effective. Yet we know without any degree of uncertainty that these are devastating people's lives. Look at the decisions that have been made in the name of, well, there's a fear out there, therefore we have to do everything possible. For example, we've locked down schools. We've gone to remote learning in so many places. Even the head of the CDC now admits more kids have died as a result of the lockdowns than as a result of COVID. And one of the safest places for these kids to be is back in school. But because we've accepted the idea that, well, the government must know best, we've allowed them to make decisions that not only take away our freedom and harm us economically and in other ways, but there's no provability whatsoever that they're helping against fight the virus. And we see this over and over. There are legitimate questions, such as I would love to ask Coroner Kiesling this. In order for a lockdown to be effective against an illness, it seems that lockdown would have to take an effect and be in near totality before the virus spread. But we know now that the virus spread long before even health professionals like Dr. Fauci said that it was something to be concerned about. So at that point, once the cat's out of the bag, what good are the lockdowns? And the problem we see is, I'll finish up with this, is that it becomes a non-falsifiable premise, right? So what ends up happening is they'll say, well, we need the lockdown. Okay, so let's say we do the lockdown and then all of a sudden COVID cases would disappear. COVID never became a big deal. So way back last year in February, we would have locked everything down. COVID wouldn't become that big of a deal. Would the government have said, oh, I guess we were wrong to do the lockdown. COVID wasn't that big of a deal. No, they would have said, see, the lockdown worked. Now, let's say that we did the lockdown and millions of people died of COVID. Would the government have said, well, I guess the lockdown was ineffective. Millions of people died of COVID. No, they'll say, see, we were right to do the lockdown. This is the problem. When you get people in positions of power, when you give the government more power, they are always, always, always going to attempt to get more of that power. They will never say, yeah, okay, we took that power, now we'll give it back to you. And we've set forth a new precedent. How is this any different than, let's say, West Nile virus or H1N1 or any of these other illnesses? We were told by credible medical experts these were going to be serious medical problems and that could be a pandemic that would be wide-reaching. Clearly, it would have been a mistake in those years to shut down the economy like we have. But going forward, how will that not be the case? If we accept that people like Governor Wolf are allowed to arbitrarily say, we're just going to lock everything down, there is no reason that wouldn't be applied to those same types of illnesses in the future. So I think that's just my interpretation of expounding on what you're saying, Carlos. But yeah, I mean, we're giving up our freedoms. And how many times has the federal government and the state government been incorrect in the things they've said? They said, health experts said it was okay to go protest for Black Lives Matter. That was okay. Remember in March when Dr. Fauci and others told us don't wear masks? Remember that? And I said that was something so stupid only an expert could say? That's what they told us then. Remember when they told us that we had to embrace lockdowns from schools? And now they're saying, oh, wait, no, actually, that was a mistake. You remember when they said lockdowns were good? And then the World Health Organization came out and said, actually, lockdowns are a mistake. You should only do it for a week or two if your ICU beds are filled. How many times are they going to be proven wrong? And we have to take the known pain of people suffering. Millions of people, 60% of small businesses will never reopen as a result of these lockdowns. 60%. We have destroyed our economy for a solution that we have no proof is even remotely effective.
I'd like to add to that. When you start to shut them down, and people and business owners are very amazing. They're resilient. They'll find ways to make money, to stay alive. And some went to online. Others went to takeout. And I can name time after time what they've done, the ingenuity behind their decision. Time after time, I can tell you that they've learned how to cut expenses and get more profits Now, from a commissioner's point of view, I don't like that idea for one reason. As more and more brick and mortars go out of business, brick and mortars is where we get our tax base from. And when we lose them and landlords are not collecting rents, they appeal their properties, and guess who it falls down on? It falls down upon your residential properties. That's another big issue that we face here in Lycoming County. One that is, boy, it's tough. To get on one more subject, when I was out at the hospital, I noticed this. And Carlos, you're Latino, I'm Italian. We talk with our hands. But another thing that we like to do is we talk with our hands, and we put our hands to our mouths and our face and stuff all the time. I don't see Todd doing that. I haven't seen Chuck doing that. I have not seen the healthcare frontline people tugging at their mask. And but who do I see? Just the normal people that aren't used to wearing masks, and they're tugging at it, and they have their hands all over it. And let me tell you something. That is a huge contributor to the virus, the spread of the virus, because it's going right from your hands to your mouth. Or if you are affected, you're doing the same. You might put your mask down on the restaurant table. Okay. Wearing the mask are important, but boy, what's just as more important is that you keep your hands off of them. Okay. And when I say they're important, I guess it's your own belief. But for now, I'm going to listen to the expert here at our local hospital, and I'm going to mask up for certain. Yeah. Carlos, I can't hear you.
You're muted, Carlos.
Carlos, you're muted.
I said that the DNA of my Latino hands is that they have love oils, so I'm immune to all these things. So the last thing I'd like to ask the coroner, because it's 11:52 and we go off at 12. Real quick, give us an overview of suicides and drug deaths in the county, and specifically, can you try to narrow it down to a demographic, an age demographic that has really opened your eyes, like, wow, this is a problem?
Well, I mean, the suicides are pretty widespread. I mean, we consistently, Lycoming County has, for as long as I've been in the office, our numbers of suicides has consistently been above the national average. And so the ages are widespread, both with the suicides and the drug deaths. I mean, we see, the good thing is we've seen a lot above the 25 years of age up to and including, 50 and 60-year-olds that for whatever reason, they decide to start using street level drugs, and there's street supplied, and there's certainly no quality control on stuff they're buying off the street corner. And so, it's caused a significant, number of deaths in our community. And I see these, as I said earlier, as preventable deaths if we could get this drug stuff under control. But the problem is too, I think early on when things were shut down, West Branch Drug and Alcohol and these treatment resources, instead of having the regular contact with their clients, they weren't. And so they can easily fall off the wagon and, get back into using again, and unfortunately die as a result of it. Or they go for a period where they're not using, and now they go back to using the same quantity, but it's a higher purity level, and they end up dead. So it's just a challenge. But our numbers, are significant. I mean, when you look at, they say 35 drug deaths so far this year and 14 suicides, that's a lot of people that I believe have died that, may have survived if we had other resources available, or could have kept things open and kept them in treatment. Because I communicate on a regular basis with Shay Madden from West Branch Drug and Alcohol, because she hears about her clients that unfortunately don't survive.
So we will have both of you on again. We're at 11:55. We're going to let you go. You guys are friends of the show. Thank you very much for coming on today. We will continue the fight and we will continue the conversation. And thank you both very much for coming on to the show today. We really appreciate it.
Thanks so much.
All right. Thank you.
God bless you guys. Keep up the great work, and we will prevail.
Thank you, Tony.
Stay safe.
Thank you, Chuck.
Have a happy holidays.
Thank you.
Robert, 1 minute. Final thoughts.
I find I know that we didn't talk much about election interference and things like that, but let me try to apply that into what I see here. I do think that, I'm the type of person that when I see things are going poorly, that's when I do best. I think shows like ours and patriots like ours and the people that are patriots like us and the people that watch our show, we're going to be more important than ever as voices in the coming fights that we're about to see. We saw that the Supreme Court didn't accept hearing the case from Texas. Things are going to get rough. We see more draconian measures by people like Cuomo and Tom Wolf. Things that are anti-democratic, things that aren't rooted in science. Mm-hmm. I'm finding it difficult to be as polite as I normally am with a lot of people, that seemingly are okay with this sort of authoritarianism. The irony is the very people that claimed that Trump was an authoritarian, they're more than happy to support this sort of authoritarianism. For example, we have Antifa groups around the world that are fighting against anti-lockdown protesters. Antifa supposedly stands for anti-fascist. We know that they actually are fascist, but this is further proof of it. When it comes to actually standing up against government abuse of authority, locking healthy people down in their homes, they're all for it, right? So I guess the point that I'm trying to make here is judge them not by the words they say, judge them by their actions. And you could see that many of the people on the left and others, there's some in the establishment right that claim to care about the people, they don't care about you. They don't care at all. They're all for the theft of this country. They're all for the intentional destruction of the working and middle class of this country. That's what's going on. That's what Tom Wolf's doing right now. You need to stand up against this authoritarianism. Support any business that stays open. Support them if they get punished by the governor, no matter what state you're in. Do what you can to show people that it's not just about being selfish. It's about pointing out the hypocrisy and how this is being used not to keep us safe, but it's being used to pick winners and losers from the establishment government so that they could have a great reset and destroy the biggest impediment to them achieving global power, which is working class people in the first world, particularly in the United States of America. They lied. They stole an election, and I'm not even talking about election day fraud. I'm talking about the fact that the same people that told you 12 Russian trolls stole the 2016 election have no problem whatsoever with the intel agencies, the tech monopolies, and the mainstream media working with Joe Biden to suppress and claim any story showing the criminality of Hunter Biden and Joe Biden was Russian disinformation. They did that. That's more interference in our election than anything Russia could ever do. Those are the exact same people, those experts are the exact same people that are telling you, oh, it's cool, Black Lives Matter protest, go ahead, that's cool, but you can't work anymore. Sorry, you can't do that. You can't go out anymore. This is clearly being arbitrarily done. And let me say that I've been saying this on my show. I don't know if Carlos or Todd will appreciate this, but as far as I'm concerned, Secretary Levine and Tom Wolf should face criminal prosecution and life imprisonment for intentionally putting COVID patients into nursing homes. And we, the people of Pennsylvania, need to demand that this occurs, that they face prosecution for their crimes of killing tens of thousands of people in nursing homes in Pennsylvania. And we should not rest until that occurs. It is no longer time to play safe and say, oh, this potentially was some sort of mistake. It wasn't. It was intentional. And we need to start electing Republicans and start demanding more of ourselves to hold these murderous thugs accountable.
1 minute, Todd, at noon. Thank you, Robert.
So as we sit here on a Saturday now afternoon, every day we go forward, walk and live as free people. Know that this show has your six, as Wendy Bell likes to say. And every day we go forward, it's one day closer to the launch of the Wendy Bell national platform, multimedia platform. She has your six. Carlos, Rob, myself, we all have your six. Walk and live as free people, man. It's personal responsibility, personal decisions. And then that way we take care of each other. But we're not going to live under, king rule. I mean, there's a reason, that we left England back in the day to set out for a free country. This is not what freedom looks like at all. It's tyranny, plain and simple. Have a great week, guys.
Thank you, Todd. Thank you for joining us today. Thank you for our guest, Tony Massar, Lycoming County Commissioner, and Lycoming County Coroner Charles Kiesling. We must stop assuming that everything is going to work itself out for the better. What these governors are doing are dress rehearsals for even more soft totalitarianism that's coming. Optimism is not a plan. So I want to remind you in closing that the most important tool that you have, to be able to live in a free country, okay, and to be able to inspire other people to believe in the things that you believe in, especially if those things are freedom and liberty, is be happy. Do good. Be good. Do right. Pursue virtue. And at all costs, no matter what happens, never give up. We'll see you next Saturday.